hormati. Terima kasih kalau Bapak dan Ibu sudah bisa hadir di tempat ini pada malam hari ini, memenuhi undangan kami. Saya Andi Sulaiman dari Jakarta. Saya akan memberikan sedikit introduction tentang Dr. Lim yang saya kenal udah berteman lebih dari 20 tahun. Beliau di Singapura, ya. Beliau itu profesor matematika dan biochemical engineer dari Nanyang Technical University, ya. Doktornya diambil dari Amerika, dari Duke and Stanford, right? Ya, jadi pada kesempatan ini Dr. Daniel Lim yang umurnya nggak jauh dari saya, tapi kelihatannya jauh benar bedanya gitu. Rupanya baru tahu sekarang ada rahasianya ini, ya. Umurnya nggak beda jauh, tapi dia kelihatan jauh lebih muda dari saya gitu, ya. Jadi buat ibu-ibu, malam hari ini suatu opportunity belajar nih, nggak usah sakit-sakit lagi pakai operasi plastik, kelihatan jauh lebih muda, lebih cantik nantinya. Ya, oke. Jadi pada saat ini kita akan sama-sama, ya. Nanti kalau misalnya ada pertanyaan, ya itu akan kita ada session question and answer. Dan untuk informasi aja, beliau masih ada di Surabaya sampai besok. Jadi kalau misalkan ada Bapak Ibu yang tertarik ingin mengetahui lebih lanjut, ya bisa menghubungi beliau besok ada di sini, ya. Oke, tanpa panjang lebar lagi, saya ingin mengucapkan terima kasih juga buat Pak Darmawan, ya, yang sudah membantu sehingga terlaksananya acara ini, dan juga untuk Pak Alex Ang dan Dr. Riza dengan tim semua dari National Hospital buat kesempatan diberikan kepada kami dan juga menjadi host bagi kami pada malam hari ini, ya. Selanjutnya saya akan mempersilakan kepada Pak Alex untuk memberikan sambutan on behalf of the host.
Selamat malam, saya ucapkan kepada Bapak Andi Sulaiman, yang terhormat Dr. Daniel Lim sebagai pembicara malam hari ini. Saya ucapkan terima kasih juga kepada para tamu, undangan dan rekan-rekan media, juga para staf dan dokter National Hospital yang saya kasihi. Puji dan syukur marilah sama-sama kita panjatkan kehadirat Tuhan Yang Maha Esa atas limpahan nikmat, rahmat, serta karunia-Nya kepada kita sekalian. Hari ini National Hospital secara khusus mengundang Dr. Lim untuk memberikan edukasi kepada kita semua mengenai organo stem cell yang merupakan terapi yang dapat menyembuhkan berbagai macam penyakit. Dalam seminar malam hari ini, saya harap kita semua dapat semakin mengerti mengenai pentingnya terapi stem cell ini sebagai terobosan baru di dunia medis. Sekali lagi, saya ucapkan terima kasih kepada Dr. Lim yang telah meluangkan waktu dan dapat berbagi pengetahuan kepada kita semua. Akhir kata, selamat menikmati acara ini, salam sehat, dan selamat malam.
Okay, good evening, ladies and gentlemen. I will speak in English because I don't know Bahasa Indonesian. But later, if you have questions, I think Pak Andy would translate. So I just want to start by thanking Pak Andy for helping to organize this, and very grateful to the National Hospital Surabaya, and of course the owner, Mr. Alex Ang. So thank you very much for this honor. Doctors, nurses, medical staff, ladies and gentlemen. The title of my talk is Organo Stem Cells. I'm going to do a few things. I'm going to explain what it is, why is it so good, how is it different from other stem cell therapies, and then I'm sure there'll be lots of questions. So let's start. We are actually the official partner to the organo stem cells in Germany. So this is happening in Germany. This is who I am. Thank you for the introduction just now. So for me, I did quite a number of things, mainly mathematics on probability, statistics, and then biomedical, which what I taught in the university. And then lately, I'm doing more and more artificial intelligence to relate to fintech. Okay, I wanted to mention one thing here is I was actually attached to the Oak Ridge National Laboratory. My supervisor, Thomas Zachariah, is now the director of Oak Ridge. Oak Ridge is where the atomic bomb was invented by Einstein. Of course, Einstein did not want to hurt people, but he didn't realize that actually they're going to use it as the atomic bomb that bombed Hiroshima. Now, obviously, I don't do weapons, right? I look after people's health. So for me, I'm using energy to heal people. Okay, so yeah, I was also director of the NTU's biomedical and pharmaceutical. So this is all over throughout the university. Okay, so I wanted to start with this, that this is the key word. The human body heals itself. So if you remember, if let's say you have a cut, right, and it's painful, maybe the doctor help you sew up, maybe the doctor give you pain medicine, but we wait for the body to heal itself, right? Now, the second thing is, remember when we were young, small boy, small girl, when we cut, we put some saliva, tomorrow, okay already. Now when we are older, you notice like your parents and all, when you have a cut, sometimes 2 months, 3 months to heal. So you notice when you fell down last time and you knock your hip, not much problem, right? You rub, tomorrow okay. When you're an old lady, you fall down, it fractures, it breaks apart. And when it breaks, it cannot heal, simply because there is a short of stem cells. So this picture shows that when we are born, we have about roughly 4 billion stem cells supporting about 40 trillion cells in the body. Okay, so what are cells? Maybe like if I look at the heart, it's not just heart cell, right? Heart got muscle, got endothelial lining, got nerve, got many type of tissue that makes up the heart. So in fact, there are 220 different type of cells. So these 40 billion stem cells must become all the different type of tissue so that your body can heal, function, rejuvenate, and it works well. Now, when we are teenager, imagine from 40 billion drop to 400 million. Okay, 400 million is still a lot. So remember, you're 15-year-old teenager, you play football, you knock yourself, again you repair very fast. So 400 million stem cells can support this 40 trillion stem cell. But you notice when we go 30 years old, immediately this one more than half. So 30-year-old, sorry Alex, but 30-year-old people like me, I'm almost 60, like Park Andy, we think 30-year-old very young, but actually 20-something-year-old will find when he's 30, how come suddenly I feel old? Okay, you don't know why. Imagine now you're 50 and at 100 million stem cells. So those who are 50-year-old, I won't ask who, okay. Or if I ask you, just pretend you're young, I just keep quiet. At 100 million, you notice a 50-year-old actually stops repairing very well. Okay, so we start to have wrinkles, and so we don't really look too young, especially if we don't look after ourselves. Now imagine now you're 80 years old, you are down to 20 million stem cells. 20 million is only enough to keep you alive. So imagine if you are 80 and now I have a major fracture. The fracture will be hard to heal. Okay, so sometimes if we think in terms of stem cells and the number, the quality of the stem cell and the ability to rejuvenate, we can decide what to do. Okay. Okay, So the key concept to summarize, the body heals itself, and cell rejuvenation is the key, right? Because cells will die, even brain cells will die, so but it can replace. So if you are older, brain cells die and don't replace, then memory not so good. Okay? So stem cells are the basic building block of all cell, tissue, and organ rejuvenation. Okay, so it's very important. I want to bring you back to this photo. I put this here because you notice that as the person age, when he's young, he look like that. When he's old, he look like that. Why? Right? Fewer stem cells just mean that it's not just the bone start to compress, but the muscle becomes weak, smaller, so unable to hold up the body. Right? So recently we had a trip to Germany to do organo stem cells, and one of my friend, he said, wow, I grow 4 centimeters. So stem cell can make me taller. I say, no, right? What happened is, he was tired, he hunched, but later he feel good, so he stand up straight. So I said, 4 centimeter in 1 week cannot, okay? But now you look younger because you stand up straight, okay? So you notice, if you tighten, muscle tighten, nerve tighten, cartilage tighten, you will start to shrink, right? So interestingly, for people who don't know, the leg don't shrink very much. It's the upper body, okay? So how you tell a person who is shorter than you, but last time he's tall? Actually, the length of the leg. Okay. So this is stem cells. So this is what we call the basic building block. And the stem cell can become many different types of cells, right? Brain cell, blood cells, fat, and so on. Dr. Lawrence Johnston is from FDA and the director of National Institute of Health in the US. So he mentioned stem cells are going to play an increasing role in restoring function lost to disability, disease, or aging. Okay, and they are the cells of renewal and regeneration through many regenerative energies are mediated. English a bit, quite high class, but what he's trying to say is stem cells are very important, and if our body do not have enough stem cells, then we have to transplant. That means we have to put in from somewhere else. Okay, so that's why to give the needed regenerative boost. So sometimes I use this to try to understand why diseases like, we say diabetes. Diabetes is quite a simple disease, right? Easy, right? You eat too much sugar, so you eat less, then no more diabetes. How come the diabetes don't go away? In Singapore, the doctors tell you diabetes cannot be cured. High blood pressure cannot be cured? Cannot be cured, right? Why? Simply because the body continue to age. So in doctor world, we believe that the body continue to age. The only way to de-age is to do the regenerative boost again with stem cells. So that's why sometimes when you think of diseases like, let's say, memory loss, Alzheimer's disease, let's say. Alzheimer's disease is early stage memory loss, right? The early stage dementia. Dementia is worse. Alzheimer's not so bad. How come can he gain back his memory? Answer is no. Because at the old age, our body cannot regenerate my own brain. So sometimes for certain diseases, we introduce stem cells. Okay, what is the key difference between the organo stem cell and other stem cell therapy? The main difference is we ensure that all the tissue and tissue organ, all those related with aging, for example, head to toe, hair drop, skin not so nice, right? eyesight not so good, even taste but not so good, smell loss, hearing not so good. You go down, there's heart, right, the lung, liver, kidney, spleen. So all the organs, including the reproductive organs, are not so good, right, as we age. So what we do is we target all these to rejuvenate. So you take Parkinson's, if let's say I'm a 60-year-old with Parkinson's, means the handshake, cannot control. But 20 years ago, when I'm 40 years old, my hand did not shake. So what happened? Something aged, maybe hormone imbalance. So in the medical world, we say Parkinson's is due to, I use the big words first and I'll explain it. The substantia nigra, which is the core of the brain, is not producing enough dopamine. Okay, so the brain not producing this chemical and therefore my handshake. So sometimes as a scientist, I wonder, is it so simple? Is it just the brain not functioning? Could it be the hand muscle cannot coordinate, right? The twitching, the firing is not working. Could it be the brain cannot signal the hand, right? Because my hand is not still. My hand is up, down, but it looks still. And your body fire up, down, and so that it looks still, okay? So again, the decision is if we can target all the different organ, make all the organ young again, whether brain, eye, everything simultaneously, then maybe we can improve Parkinson's, okay? So this is the concept. Okay, so this OSC ensures that all the key organ and organ tissue relating to wear and tear through aging is rejuvenated, made younger. Then the next thing is it's only a one-time treatment, meaning they inject you and maybe you can go back every 1 to 4 years if you want to continue, okay? So usually what we do is we engage a hospital to do like imaging tests. I went through this hospital facility and it was excellent. It can measure fat, so many top equipment, you know, so you can measure all this and then actually do follow-up checks. Then anything wrong, you just intervene, right, medically. Okay, so again, for numerous complicated disease, I like working on complicated disease. Okay, so when I invent things for the hospitals, I usually look at things like multiple sclerosis. That's a nerve damage in the brain, right? So you cannot reverse that. So we are now able to do that again by boosting all the organ and organ tissue at the same time. Okay, thyroid for hormone balance, brain, heart. So we just boost everything at the same time. Yes? Oh yeah, pancreas as well. Yeah. There's no pancreas there, is it? Yeah. So pancreas, for example, diabetes. Why you're diabetic? Because as we age, the pancreas have something called beta cells. The beta cells produce insulin that can combine with the sugar you eat and then, you know, manage sugar levels in the blood. But as we age, the pancreas, the beta cells start to die, become less and less. So the pancreas produce less insulin and therefore your body cannot handle it, right? So if you rejuvenate that pancreas, you regrow the beta cells, one day maybe it's easier to manage diabetes. Okay, because diabetes, if not managed, doctors will tell you some people need to cut off the leg, right? Some people go blind. There are many other problems, diseases that can relate to uncontrolled diabetes, including cancer and all that. Okay, now who would like to go for organo stem cells? These people who want to improve one or more complex disease. So some people tell me, I wait until I get many disease, then I go. Well, because same price. Okay, usually try not to wait because the more problem, the longer it takes to heal. Okay, so even chronic complex disease or even incurable diseases. So like pain, bone problems, nerve problems. Nerve damage is something the body is hard to cure by itself unless you're very young, right? So the other thing is okay, like brain also. Brain, when you damage the brain, your body is very clever. It can actually mirror image. So the functions you lose can be taken over by the other side of the brain to some extent, provided you don't lose too much brain. Okay. Now, who else? Maybe couples who want to get married, they want to have children. China, we have a lot of this, where I can only have one child. So I want my child to be Superman, super tall, super handsome, super smart. Okay, like Alex, right? I want an Alex. So some couples, before they consummate, they actually, husband and wife go for the organo stem cells. So they improve the health status as much as possible, while actually correcting weak chromosomes or even faulty genes. Okay, so you try to, any problem with the wife, with the husband, you try to rectify so that the gene transfer to the child becomes optimized. Okay, the last group are people who just want to be, continue to be at their peak. So physically, they want to be fit. Mentally, they want to be sharp, right? So they just want to look and feel good, improve skin and all that, right? So actually, this group of people, for the same price, get the fewest number of injection, 9 injections. This group of people usually get about 10 injections. This group get maybe 10 to 11. Okay, so that's how it works. Okay, some studies, you can see muscular dystrophy. This is a disease where the muscle just degenerates. So what happens is, you can see this is where the muscles start to small and small, so the leg become weaker and weaker. Usually by about 6-7 years old, the small boy cannot, at 3-year-old he run around, by 7-year-old he cannot walk. He's usually in a wheelchair by 10 years old. So you can see by using stem cells, we can actually regenerate that muscle. So it's not just giving him more muscle, it's giving him the ability to grow muscle, grow and maintain muscle, right? The nutrient supply to the muscle and so on. So that's why it's a multiple rejuvenation. This one is where he got a traumatic spinal cord injury. You can see the fibrils in the brain become not so defined, okay? And on the right side, you can see actually it can improve. So you can signal the brain to actually regenerate the brain itself. And that's how we also deal with the multiple sclerosis. This is a stroke patient. This is a PET scan. PET stands for positron emission tomography. And the more black the area, the more nothing working, no chemical reaction, okay? So the black, the blue are bad, green is okay. So you see, after stem cell, it's less and less blue and black, okay? Meaning the brain is regaining more and more function. So we have all the regulatory certifications. Is actually regulated by the German Health Ministry for the purpose of health. Okay, so even we use sheep. So even the sheep has to be grown in a certain way, right? They have so they are mountain bred. So they are in a mountain where the air is fresh. They eat only organic food, and they then reproduce baby lamb that are healthy. So you run through a few generations, eventually you get healthy sheep. And we only have about 680 sheep. this sheep you cannot make soup kambing, you cannot use for any other purpose, right? The Ministry of Health say intended for health. Okay. Okay. So what does this? It's actually sold as like a holiday. So you go for a 5-day holiday, everything provided, food, hotel. You don't stay in hospital. You stay in a hotel. We convert the top floor of the hotel to a hospital. Okay. So there's no surgery. So okay. So basically, it's 60 years. It started 60 years ago. Stem cells were only discovered in about 1960, 61, 62, accidentally. Okay, so this is actually ahead of the time. Now it's run by the 3rd generation already. My friend, also called Daniel, he is the new CEO. He's also quite young, about 45 years old. Okay. Yeah, so it's a one price, no hidden cost, no upselling. Full medical care, hotel room. We just changed hotel, so no more award-winning restaurant, but it's a nice restaurant. I'll show you some pictures later. So the price just exclude aeroplane flight, right? Because some people fly first class, some business, and some economy. Backed by world-renowned doctors and scientists. Yeah. So usually when a person goes, we want him to be very relaxed, happy, relaxed, sleep a lot, eat a lot, and and this is the best condition actually for your tissue to rejuvenate. Yeah. So sometimes if we notice husband and wife go, share same room but like to quarrel, we say, maybe can you, for the sake of your health, have different room. Okay, so what are the benefit? Again, all the organ tissue are rejuvenated for one price. Even medically challenging, especially complex diseases are usually hormonal based, brain based, nerve damage related. So you find we are exceptionally good at managing this. For the next 6 months after the injection, you will feel better and better, stronger and stronger, smarter and smarter. Okay. The good part for the girls is who care about skin. Skin very, very fast. Within 3-4 days, you can see the skin improvement. But nerve usually take longer, like 3 months. So we typically say at 6 months, you are best of the best that you can be at that point. Then if you want to go back, usually depending on your age or your health condition, you go back 1 to 4 years later. Right? So, people who are too rich, can I do every 6 months? The answer is you just waste money, right? Because the body needs time to naturally improve. It's not like surgery. Surgery, the good part is we cut you, tomorrow you okay already. Right? This one is different in that it needs to naturally, your body to naturally heal and improve itself. Okay? Okay, then it's pain-free. Now remember, pain, when it comes to stem cell, we cannot use general anesthesia. Okay, otherwise the stem cell also fall asleep. So we use a technology that actually induces the body's natural norzistatin, which is the own pain-killing system to manage itself. Okay, targets up to 85 tissue. So like girls, we even target the ovaries, reproductive system. For men, of course, the testes and all that. Okay, so libido will increase very significantly. Yeah. Okay, so why is it called organo stem cell? Because they are made of 2 parts. The organo, which is organ to organ, meaning that if I use we have a lamb and then we extract the different parts of the lamb. Okay, so for example, if I want a reproductive system, I need a baby lamb and I extract from the testes. Now, let's say if I want heart, I will take the baby lamb heart stem cell, put it in here, and then heart will go to the heart, liver will go to liver, and so on and so forth. So some people say, actually it's quite cruel, but it's no different from if you eat soup, lamb soup kambing, you have to, the lamb have to die. So the lamb actually is sacrificed, but the good news is it's regulated, it's ethical, and one lamb, one baby lamb support 20 human beings. Okay, so it's, I think even you eat a baby lamb is, can't even feed a few people. Okay. The second part is there is embryonic pluripotent part. So this pluripotency means that these stem cells can turn into any stem cells as the body determines. Other people usually just use this one, like placenta and all that is just only number 2. Right? So sometimes maybe I have a failing kidney, failing liver, I need kidney dialysis. So I do stem cells using only this part, the pluripotent part. What may happen is I have very smooth skin, but my kidney is still weak, right? Because the stem cell didn't convert to kidney cells, right? So for us, we target all the organs. That means we guarantee all the organs are younger. Okay, so this part is important. You see, damaged or spent human cells can be stimulated and regenerated by living cells. So when I put the lamb stem cell, the heart cell will talk to the heart, your human heart. So the lamb don't become you. Like if you go 1 time, 2 time, you start to meh. No. The heart cell talk to the human cell, the liver cell talk to, but when they talk, the body thinks that it's like a baby. So when they regenerate, it's going to look, the organ become younger and younger. Okay, so that's how it works. Then later, the lamb cell will come out of the body. Okay, so skin, you see skin, we don't just use like cream, right? Just topical cream on top. There are many layers. There's fat, there's muscle, there's fibrins, there's collagen. So we target all, right? There's even, you see, muscle group below. So imagine you have nice, smooth skin here, but no blood supply, poor muscle, you find it won't look as young as, so it's not, so this one builds you from the inside. This is nerve damage in the brain. So if the neuron, they have the damaged myelin, the sheath is damaged, there is no repair, right? In fact, this picture is a nice one. This is a healthy brain with, this is healthy neuron, and you find this is Alzheimer's. That's why he lose memory. The brain shrink. The fibrin got plugged, got all these toxins stuck here, and then it's entangled. So it don't look clean. And that's why it's very hard to heal. Surgically, last time when I work with the neuro department, there's no way a surgeon can actually make this become this. So the only way is using stem cells and hope that your own body repairs itself. Okay, this is Parkinson, which is just signaling. Okay, so I put here for a while. These are all the issues. Anything that revitalizes, so brain, immunity, everything. Anything relating to premature aging, wear, tear, skin, cartilage, bone, brain, gums. Like my father, he's healthy, but he's old, so his teeth drop out. But he liked to eat rendang, so he cannot eat. So we must make rendang just a soup. But all functional and degenerative damage like kidney, GI tract, neural function, spine, bone, joints, all allergies. Multiple sclerosis is damage of the brain and nerve and spine nerve cells, all heart-related, including arteriosclerosis, which is the blockage of the arteries, hormone disturbances, and then low sexual potency. So we boost everything at one time, and that's what it does. Okay. Okay, these are some pictures. So now no more science. Now easy. Just see picture. This is my friend Daniel, and this is our lab. This is his mother, which is the daughter of the founder. Okay, she's chief medical, so she's a doctor. These are people. Okay, so usually we also help you relax. One of the key issue is before you go, we assume people are working because we have a lot of CEOs that go. They are always hyper. Even when they go there, they're still working. So we try to relax, We tell them very good CEOs can leave it to their manager to run the company. So don't worry, just relax for 5 days. So we help them relax. We bring them to the mountain. We look at nice nature. These are the room, so-called treatment room, but actually it's a hotel room with all the facilities. Food and dining, this is the restaurant. So there's a buffet style. And then, you can walk around the town, do shopping and all that. Okay, then there are other things like spa, private massage, right? Cruises, balloon rides, anything that you feel will help person relax. Okay, so very interestingly, there's a concept called what do you call? Basically, I'm going to say this. If you are not stressed and you rest, tissue will repair. Okay, if you are stressed and you don't rest, like you don't sleep, you don't like to sleep, you work and work and work, tissue don't know how to repair. And this is just part of the body mechanism. So that's why in the end, I used to joke, I sleep very well for 1 week. I'm a scientist, so I don't like to sleep. So I say every year I go just to sleep. Of course, to do other things. Thank you. Okay, I'm almost done. This is the last slide, 1 or 2 more slides. We like to make private side trips. So usually if I go, I like to visit Salzburg in Austria or Prague, right, in Czech Republic, or Venice in Italy, right? So I'll do a side trip. So most of the time, when you book your flight, we encourage you to try to arrange some relaxing side trip. Okay, don't go and do parachuting. Okay, so the upcoming treatment dates are these. There are 4 dates for this year, and bookings have to be done at least 3 to 6 months ahead of the treatment. Because last time we have COVID, so for about 2 years, nobody can go. And after COVID, like China haven't really opened yet. So we are anticipating when China opens, the place will be booked. Right? So we are actually booked like June, July, August, all booked. So the next dates are these dates. Then otherwise it's next year. Okay. So if you have any interest, you can contact these people, Cindy or Pak Andy or Ibu Devi. Just call them, and then we'll need to find out from you like what are some of the issues you have. Okay, if you don't know what are the issues, it's also okay. We just assume old people have all these problems. Okay, so I am done. I wanted to keep this talk short, and now maybe we open for a time of question and answer. Feel free to ask in Indonesia, then Bahasa, and then Pak Andy, if I need your help to interpret. Okay, any questions? Oh, okay, why lamb? Okay. Okay, very good question. I also asked that question last time. Why don't choose lion or elephant, right? Can live long, or I don't know, turtle, or chicken, very cheap. The answer is we have tried all these, and only lamb and deer are the best. That means the stem cell know how to talk to the the human will respond to the lamb cell. Okay, why we didn't choose deer? Because deer is expensive and only 1 million deer left in the world. At home. Okay, so like chickens, we prefer free roaming lamb. So big place and then they run. Uh, yeah. Okay, once how we see cancer? Cancer is a mutation of a healthy cell. So when you're young, you have usually no cancer, and then you grow old, the immune system drops, the environment affects, and then you find the cells start to mutate to a cancerous state. Why are we afraid of cancer? Because cancer grows very fast, then one day it takes over the organ and your organ don't function, right? No more health, no more like kidney, or no more stomach cells. Now it's all cancerous cells. They are grow uncontrollably. So by signaling, by putting healthy baby lamb cells, you are trying to signal the mutated cell to reverse signal. Okay, so when they reverse signal, like if I'm a bad guy, but all of you are good guy, I do one bad thing, everyone, then okay. So maybe the cancer not as aggressive, gradually. So what we are seeing is, usually cancer grows like this, faster and faster. We call it exponential growth. When we do this, actually it grows faster and faster and then straight. It still grows, but linear. Then after that, it taper off. It stop growing. Then after that, it shrink. Okay, but sometimes it takes about 2 years, and they go about 2 times, 3 times. Yeah. Okay, leukemia is easy using stem cells because that's right. That's right. You basically okay. So it's not just transplanting bone marrow, because if it's just the bone marrow, then we always have to keep transplanting. So what we want is initiate the brain, the bone marrow, everything to work. Then you find that the leukemia is resolved. Yeah. Yes, leukemia is quite easy for us. Yeah. Okay. Yeah. Like okay. Yeah. Yes. Even placenta stem cells will work for leukemia. So like for example, my children, my friends start companies that freeze the placenta, right? When they are born, they freeze it. And because they are my friends, they give me free of charge. But I only tell them to keep for 5 years. So once I see my son running around, no leukemia, I said, throw away. Why people keep for 60, 70, 80 years, this is my opinion, is because one day if my son, when he's 70 years old, has, let's say, a failing heart, then in theory we can, from the cryogenic, use a stem cell to grow the heart. Now it has been 25 years, we cannot do anything like this. Yeah. Short answer is yes. Meaning, what we are concerned with is how far down. Like 4th stage, no problem. But let's say if your cancer already spread so much, you're going to die in 2 weeks' time. You go today, it's not much use. Yeah. Right. Oh yes, it does. Okay. That's right, because you are affecting the current cancer, you are also strengthening the other cells, right? So imagine if the other cells, the other part is now weak, you are, let's say, sick or very stressed, then it's easy to spread. So I always say it's like, people want to rob a bank, right? One of the problems with cancer is as it grows, it metabolizes a lot of toxin. So like before you attack a bank, there's a many security guard, but if you throw sleeping gas, by the time you go in, they are all, mabuk, easy to walk in. But now if you strengthen all the security guard, then it's hard, yeah, by stem cells, yes, yeah, yeah. Yeah, sometimes what we do is when the cancer is aggressively growing, we actually use chemo, kill the cancer, and then rebuild the healthy cells. Yeah, because chemo also destroy healthy cells. And if I say we need your body to repair itself, then you have to decide. How we decide is how fast is the cancer growing. Yeah, but when we do chemo, after that we stop chemo, we do stem cell repair. So that is one of the strategies we use as well.
Chemo weakens the body and it doesn't have much energy to do a lot of things.
That's right.
The stem cell we can still have the energy.
That's right. That's pretty much, you're right.
So better than chemo, right?
It's sometimes how you decide to use them. Some people just do stem cells, some people do chemo and stem cells, but many who just do chemo, most of the time they become weaker and weaker. You see, let's say I'm old and I got cancer and I do chemo, and I circulate around the whole body, right? This chemical is going to hurt my kidney, my liver, so other things. That's why they say sometimes chemo patient, you got brain fog, right? The brain not so good, memory affected, eyes affected. But chemo is good. Why? Because it kills the cancer. Cancer is growing fast, you stop it. So sometimes we still prefer chemo. Yeah. Then you rejuvenate. But don't do together, because you put stem cell in, the chemo kill it, you just wasted 20,000 US. Yeah. No. Okay, this is a little bit complicated because sometimes we don't know the reason it cannot get pregnant. Okay, sometimes it's as easy as the eggs, not very healthy, no problem, right? Or the sperm not very healthy. In Singapore, a little secret I'll tell you. In Singapore, I used to work for the sperm bank. Okay, so we collect sperm from men who want to donate. We found that 40% of young men, 20-something-year-old, 40% the sperm no good. Okay, what do you mean by no good? Means the sperm usually got one head and one long tail, then it can swim. Okay, if the tail is half, then it cannot swim very well, so cannot reach the uterus. Yeah, so by the time they reach, and you only need one sperm to make one baby, right? So sometimes, but if you think, if Singapore young men, 40% cannot, your pretty daughter marry them, there's a chance, quite a high chance they cannot give birth. Okay, so sometimes when I used to talk to Singapore government, we are giving money, right? You have third child, we give you money. First child, we give you money. Sometimes the money alone is not the problem. It's the boy is too stressed. Okay, or maybe the food we eat, every day eat, I don't know, sorry, McDonald's, or no nutrients. Then maybe the sperm not as good. Okay, so to answer that question, actually we have a lot of Chinese people care about this. They usually will go for the organo stem cells. The husband, the young couple. 40 genes, yes.
Stem cell also make that, right?
Yes, yes. But we use words like it may correct because it's hard to guarantee perfect. Yeah, yeah.
Just that there is hope of improving the chromosomes.
In a professional view, I think this is I think it's more or less the only way and the best way, and probably the cheapest way. Yeah, of course the other way is eat healthy and all that, but it's when there's a faulty gene, it's very hard to just eat nutritiously and then it correct itself. It just takes too long. People don't have the discipline, etc. Okay, welcome. Yeah. Okay, thank you. It's a fantastic line of questions.
No, I asked because my wife stem cell, because at the time the stem cell just started, so starts very much from healthy cells. But
Yeah,
we decided to go for chemo, and she succumbed to chemo, and then
yeah, yeah. We have quite a number of cases now where they start chemo, and within 5 minutes the body cannot take it. So the doctor have to stop the chemo. And doctor, I work very closely with doctors. We only have a few things: medicine, surgery, radiation, burn the tumor, or chemo. Of course, there are different versions of chemo, but we only have these 4 things. So sometimes if chemo cannot, surgery cannot, and then it's deep inside, we cannot burn it out, we can't do radiation, there's not much choice. Yeah. The other thing, autoimmune, there's a growing number of autoimmunity, means your body immune system attack the healthy cells. Okay? So not too long ago, just a few years ago, we didn't really understand what causes autoimmunity. Now we think we do. So about 4 years ago, in Cambridge, University of Cambridge reported that they believe it's inflammation, this concept of inflammation. But let me explain a bit scientifically. When inflammation, like if you get cut, then there's inflammation, there's a hot pain and so on. So the body knows how to go to that spot and fix it, right? So the cytokine, you've got bacteria, we fight bacteria. So you repair, and then when it's repaired, the body say, okay, good, go back to homeostasis, go back to normal. But if you cannot repair, let's say due to cancer or due to even stress, every day you work and you got stress, then what happens is your inflammation become chronic, always there, right? Then what happens is we have this thing called a cytokine storm. Means your immune system go to the inflammation to fix it, but cannot fix it, right? So you call more reinforcement. So more and more go. Eventually, too many, they start to destroy the healthy cells next to it. So you have autoimmunity. Yeah. So sometimes, although we are medically today very modern, we got stem cells, we got surgery, we got all sorts of things. Individually, we have to learn how to manage our own stress as well. Things, simple things like forgiveness. Right? We always hate somebody, is being able to forgive. Right?
Oke, mungkin ada pertanyaan lain. Pak, silakan.
Okay, my question is on behalf of Pak Dermawan here. Okay. Okay, thank you for your presentation. Can you please provide us with specific studies or clinical trials that support the efficacy and safety of the stem cell therapy that you discussed? And could you share the names of researcher and institutions involved in these studies?
Okay.
Thank you. And whether it is already FDA approved or not.
Okay.
And when the approval is it the treatment or the harboring of stem cell or what? Or can you guarantee the result?
Okay.
For instance, if I do stem cell, do you think my hair can grow black again?
Your hair or what?
No, thank you, thank you.
Where? Which part? Yeah. Why I joke is one day I use a cream, a steroid cream, and from my elbow, hair grow. Okay, so I stopped using the cream. Okay, this is a question that a lot of top doctors, so you must be top doctor like to ask. Show me the proof. The short answer is stem cell is not a medical procedure. It is what we call general wellness procedure. So in Europe, doctors are more open. In Singapore, doctors don't accept this. Okay, if you ask a Singapore doctor, is vitamin C good for you? We know it's good, right? Doctor will not say, well, if you think it works, you take. Why? Because a doctor cannot recommend supplement. Supplement is not a drug, not a pharmaceutical drug. So the short answer is, it's not medically approved. So even when we do studies, like what I show you, it is one-off. It's not a clinical trial. Like, clinical trial means I do animal tests, so I do a lot of clinical trials. Animal tests, and if safe, I do human tests. But human tests, you see, if I, let's say, want to do, say, cancer. So if I want to say, does organo stem cell heal cancer? Now I need a room full of cancer patient, right? Male, female, and all that. Then, but this cancer patient cannot have heart problem, diabetes, all that. So it's in Singapore, very, very hard to do. Yeah, so it is not FDA approved not because it is not safe or doesn't work, it's because it's not medical, it's not part of mainstream medicine. Yeah. Are there studies? Yes, but for example, a royalty in Brunei, I won't mention who, is not going to tell you, oh, I do it and yeah, actually I got cancer. Because he said he got cancer, you could have a political situation.
But I think, Dr. Lim,
yeah.
the question is, after 60 years, I'm sure
Yes,
they have results.
There are many results, and we call this anecdotal.
Yeah.
Anecdotal means, my friend went, he got cancer, and now he's better. My friend looked, now he went, now his skin looked very good, or his hair grow back.
Kemarin ada yang tanya, Pak, sorry. Kemarin ada yang tanya, ada testimonial nggak gitu orang yang ikut sana.
Yeah.
Nah masalahnya orang kaya kan nggak mau diekspos, gitu loh.
Yeah.
Jadi nggak sulit, net.
Okay, every year we have 20 times 50. Every year we have about 1,000 people. We've been running this for 60 years. Yeah, so maybe 50,000 people. Yeah, 50. Yeah, but the difference here is okay, most of those who can afford it and who went before, they just keep going back. Okay, now I tell you the truth. For me, I like going because I feel sharp, I feel energetic. I can imagine at almost 60, I can scuba dive, right? No high blood pressure and all that. However, I don't want to live under 200 years old, right? My friend all not around. So I tell myself, okay, I'm going to do maybe to 80 years old, then I stop.
As long as you want.
Yeah. So in short, many people keep coming back. Even we have people who are going to die, they still come back. So we usually advise, in your condition, this is not going to do much. But they still want to come back because they say, the last 3 years, I have no pain. I'm living, usually about 96 years old, this lady. I live like a non-cancer patient. I walk here, I eat what I want, So they are dying of old age. Yeah. Okay.
Jadi jawabannya Pak, tergantung dari Bapak mau hidupnya berapa lama. Kalau mau muda terus, nggak mati-mati ya datang tiap tahun bisa gitu.
Yeah. So when nature is concerned, when let's say your kidney is half left 20%, right? You can rejuvenate half dead cells. But if I die, you use OSC, no use because I'm dead. right? So that's how to think of it. And that's why for Alzheimer's disease, no problem. Early stage dementia also can. Middle to late stage dementia, not much use because most of the brain is already dead. Yeah,
Dr. Lim, there might be some questions from the audience.
okay.
If there is any side effect,
Oh, yes. The biggest side effect is your backside itchy.
gatal-gatal waktu disuntik, tempat disuntiknya aja.
So the point where they inject, sometimes there's allergic reaction, so it's a bit itchy, maybe for 2 to 3 days. So so they just give you a cream and yeah. Then the nurses, okay, so actually the nurses will always come in to check whether there's a reaction. So we joke, the nurses quite good looking, so we say, hey, they always want to check my backside. No, I'm an old man, but still got young nurse still want to look at it. Yeah. Okay.
Ada pertanyaan lagi dari Bapak Ibu?
Yeah.
Mungkin just information. No.
No, we can't. I did discuss technology with Daniel, whether I can freeze dry the living cell and then bring over and then reactivate here. The problem, so the short answer is can. The problem is the regulatory. So we have to still be regulated. So we have to apply to Indonesian government to. Yeah, but if you are, so usually what I will propose is, for example, people who are going, they do all the tests here, they do all the screening here, and then they go, then they come back. The doctors here follow up, right? So you find like in physiotherapy, if let's say sometimes the muscle too tight or not enough muscle, you find when he come back, he's very different. Suddenly the physiotherapy have a much easier job, so they can build upon the, if we fix the inside, then they can build on the outside a lot more effectively. Yeah. Then people would think, wow, they go to national hospital, come out are all like young men. Yeah. We have that request from rich people, can we fly the doctors come here and inject? The answer is also no, because partly is the storage of the cells. The second part is the regulatory approach. Yeah. For you, no problem.
That can be arranged.
Yeah. There are people I do sponsor as well. Yeah. So I use my own money to pay for them. Yeah. Okay.
Kemarin ada pertanyaan, there was a question yesterday, the amount of stem cell injected each time.
Okay. By the time we take from everywhere, we put in 200 million stem cells. So you remember just now the teenager, 400 million, so we use 50%. Why we don't use more? Because it's just wasted. The body just need time to heal itself. So we found 200 stem cell is just nice, because don't forget, it's 200 million foreign body put in you, you are infected. Right? So some people, if you don't manage well, they got fever or that. So we manage very, very well. If you have fever, it's for 1 minute. Just a slight fever and then that's all. Okay?
So you become youth again. With 200 million.
200,
stem
you
cell.
repair like a teenager.
Right.
Yeah. Okay. If you put more than that, then the body will have, it doesn't heal so well. Yeah. That's right, from different parts of the lamb. Yeah, the lamb. Yeah. Yes, because the lamb gets sacrificed. Yeah, if you take it from a human, so human, when we say like Japan like to do it from a human, it's an 18-year-old to 25-year-old. That human will not be my son. My son is 18-year-old. I'm not going to ask him donate 200 million stem cell. So it has to come from a poor country. We don't tell you where, and the problem with human is we cannot control him. If he take drugs quietly, he every day eat, bad food. He don't eat. He got genetic. Human can transfer a human disease. So some people ask, human stem cell even better compared to lamb? The answer is actually opposite. No, because, for example, the young man, 18-year-old, he got no cancer, but actually he's predisposed to cancer. Maybe his father and mother had cancer. When he passed to me, old man and very stressed, I may activate and then have cancer. So the quality is also important, where the source of the stem cell come from. So lamb is the safest. You never hear of lamb getting cancer. Yeah, right. Or deer. You never hear of deer like getting cancer. Yeah. It's not foolproof. Yeah, because unfortunately, let's say your gene, everything is okay. I put in you, but you see, I took it from an 18-year-old. When I put it in you, let's say I'm 70-year-old, my body may take it differently. It may have all, so he is predisposed to cancer, but when I take his stem cell, I have other old age factors that affect it, and then it may actually evolve cancer. Human. Yeah. No, because if I take 200, you see, the young teenage boy, 15-year-old boy only has 400 million. I take 200 million, he cannot repair anymore. Yeah, it's going to affect him. Yeah, yeah. So it's actually not ethical. So sometimes the trick question when we ask the Japanese, how many stem cells do you use? We use 200 million. He will definitely, oh yeah, we also 200 million. I know he's bluffing. Because if you take 200 million, that boy is going to suffer. Yeah. Okay.
Ada pertanyaan lagi?
You want to rejuvenate everything. Because one thing I like about the Germans, we don't like to upsell. Upsell means like our friend, he want to grow hair, right? And then when he go there, he make the trip, I tell him, hey, your skin, why don't you add this? Then so what started as $5,000 end up as 80,000, right? So Thailand, you see a lot of this. So in terms of business, is a good business strategy, but for me, I'm retired actually, so it's not my intention to make money from this. This is, we make a few million a year. For me, it's very, very small. So we actually don't really need this. So many of the people are mostly our own friends, people we care about. Yeah. And that's why I don't really publicize this. To maintain healthy, maybe to reduce the risk of getting cancer and diabetes and pain.
Seluruh prosesnya di sana 5 hari ya. Jadi Bapak Ibu kalau ikut program ini 5 hari akan di sana, full board semuanya, dan kebanyakan nggak ngapa-ngapain. Disuntiknya cuma 2 menit aja sehari. Selebihnya relax di sana. I said the injection only takes about 2 minutes, the rest of it fun.
Yeah, fun, relax. We always joke, try not to watch football, like, oh yeah.
Too excited.
Just relax, relax.
Yang penting relax di sana.
Yeah.
Ada pertanyaan lain Bapak Ibu?
Okay, any last question?
Mungkin I just want to explain to them what to do if they are interested. Jadi nanti kalau Bapak Ibu ada minat untuk mengikuti program seperti ini, yang paling penting adalah ada baiknya kalau Bapak Ibu punya data-data medical terakhir, yang waktu mungkin medical check up terakhir ya, atau sedikit dossier dari Anda punya health ya, itu bisa dikirim dulu ya, supaya efektif. Bukan apa-apa, bisa juga di sana di check up juga sih, nggak jadi masalah gitu. Cuma ada lebih bagus kalau kita ada sebelum pergi ya, udah ada dosiernya dulu sama mereka gitu. Dan itu tadi sudah dikatakan mesti 3 bulan 6 bulan, karena untuk musim panas tahun ini udah penuh semua, nggak bisa. Jadi fall nanti baru bisa lagi.
So we have a form. If you are interested, you can just put your name, your contact.
Ini ada formnya
Yeah.
yang bisa diisi di sini.
No obligation. So
Nanti
in-
bagi yang mau,
no obligation in that you can fill out the form and later we don't want to go, right? But maybe at least you want to know more, and we use the form to relate that okay, we come to know you from this hospital, so we'll come back to the hospital. We come back to Pak Andy, Ibu Devi, how to manage. Okay, so yeah.
oke, bagi Bapak Ibu yang minat nanti bisa minta sama saya di sini.
Yeah.
Ada pertanyaan lagi sebelum kita tutup?
Then when they follow up, usually they need a bit more information. Like that means if you don't know what to say, we just do everything. But if you are 3rd stage cancer, 4th stage cancer, brain starting to be memory, you just add on. I add everything. I add skin. I say my brain. I need brain. So I just add everything. Prostate problem, right? Nighttime.
Alzheimer.
Yeah. A high rate of success. Up to, okay, so usually it's poor memory, then Alzheimer's, and then dementia. Dementia is the worst. Up to early stage dementia, meaning you are classified by the doctor as dementia, hopefully not more than 2 years. Yeah. If you are dementia, that means you cannot even remember your house, your father, your children. Okay, I know you're going to say that you don't want to remember. So, yeah. so, if you cannot remember anything, it's it probably will not work.
Oke, kalau nggak ada pertanyaan lagi, terima kasih sekali lagi buat Bapak Ibu sekalian, buat kedatangannya, dan juga buat Pak Alex dan tim. Thank you so much.
Thank you.